The sale of drugs is at an all-time high, but adverse drug reactions are one of the top 10 causes of death globally. Do we ever stop and think, maybe some of the most common drugs are not treating people, but just their symptoms? If we could know beforehand what drug could work for us and what could not, that would give us valuable insights. This is information that can minimize the risk for undesirable side effects. This is information that could increase the odds for successful treatment. This is information that could save a life. What if I told you that all this information is hidden right inside you? You could look into your DNA, your genes, and find out how you process and respond to various drugs. This is what pharmacogenomics is all about. This is what we do with MedicaMap. When we receive your sample, we extract your DNA and perform extensive analysis to read your genetic code, your source code, and we also unravel your unique profile to help you understand your response to over 100 different types of drugs. Your MedicaMap report can tell you a lot about how your body activates drugs, how your body breaks them down, how your body prevents toxic buildup. So cue in to your genetic programming to learn what works best for you. MedicaMap is a highly personalized report that will give your doctor valuable feedback on what medications work for you and which ones to avoid. This is your doorway to personalized medicine. We need to appreciate our differences to optimize the potential for successful therapies, because one drug does not suit all.